Hi, I'm Andrea Salenza, and welcome to the lecture on sexual boundary violations. How do they happen? All of the knowledge and insight that I'll be sharing with you today, I have gleaned from my practice for over 20 or 25 years looking into this problem from all angles. At the moment, I have seen probably over 250 sexual boundary transgressors and or victims of sexual boundary violations. And the knowledge that I have gained has come from this personal clinical experience that I have, as well as some empirical studies that I have performed and a complete review of the literature and research in sexual boundary violations. I'd like to now address a lot of the myths that circulate about sexual boundary violations and dispel them with the facts as we know them at this point in time. The first myth is that sexual boundary violations actually occur at a fairly low frequency. Nothing could be further from the truth. The prevalence rate is somewhere between 9 and 12%, although I have reason to believe that it's probably higher than this. The prevalence rate, as I just reported, comes from a series of self-report anonymous questionnaires, 11 in total, that were done over the last couple of decades. These anonymous self-report studies rely on practitioners' willingness to report their having been engaged in a sexual relationship with one or more patients at some point in time. All of the studies vary a little bit in terms of how they ask that question. Their targeted population may be different, but the results are surprisingly consistent. They come out to be somewhere between 9 and 12% of all practitioners admit to having engaged in a sexual boundary violation either once with one patient or many times, multiple times with one patient or many patients.